Trigger point therapy has been around for quite a long time, and I've had at least 10 years of experience in it. And a lot of people are frightened because they think, I'm going to be putting needles into all these muscles, and how much pain is that going to cause. But overall, I can tell you 99% of patients will say it is barely painful. They feel it just like a small prick or a mosquito bite. So yes, it's very, very painless and relatively painless. It just feels like a small bite, and some needles don't even hurt as well. And because my technique, all I do is I just go in to the muscle and come out very, very quickly. This needle technique is very, very quick. Some of you may have had something called IMS, called intramuscular stimulation. And what they do is take a needle into the muscle and they poke away at it, and they go in all the different directions. And that's very, very, very painful. My needle technique is a quick in, out. And like I said, sometimes you may not even notice that the needle has went in. And this technique has served me well, so please try it, see what you feel with it. Some of the other questions I get is that, do I have to do this treatment all the time as well? And again, most people need maybe about 4 to 10 treatments depending on the condition and the length of the condition. And then once it's better, it's generally better. There's really no maintenance therapy to continue with. Yes, maybe down the line you may get the same injury again, or something may happen. Then you come back again for a few treatments, and then we do the treatment again. And most of the time you need less treatments at that time, because somehow these trigger points actually deactivates the muscle and causes that message to get disrupted. Another common question I get is, what is the difference with this technique and traditional acupuncture? In traditional acupuncture, the points are mapped out, and the practitioner then measures certain points and puts a needle in. So there's a set protocol. So if there's an elbow problem, then they would put a needle in here, which is about an inch away from this bone, 2 inches below that point, and they would put it specifically and then leave the needles in that specific point. While trigger point therapy, I'm always palpating. I'm looking for the muscle knot itself. And when I feel the muscle knot, that's where I put my needle in. While in acupuncture, they don't really feel for a knot. They have set points and set protocols that they use all around the body. Also, in this technique, my needle is a quick in and out needle. I don't leave the needles in. And yes, I do inject a little bit of local anesthetic into that point as well, and that local anesthetic decreases the nerve sensitivity. So yes, there's a dual action of the needle and the local anesthetic. These trigger points are highly electrically charged as well, and by putting a metal needle in there, it causes it to just charge and relax, while the local anesthetic decreases or the sensitivity or decreases the sympathetic drive. Because these muscle knots, what's happening is that the body recognizes there is something going on and the nerve is firing all the time. So the local anesthetic blocks that nerve pathway temporarily, and over time the nerve becomes less and less sensitive, while the needle is breaking the trigger point up.